There are several main pillars of health, especially for athletes. One of them is nutrition. The other is proper technique. The other is strength. And finally, sleep. And so all four work in tandem together. If you don't get enough sleep, you don't have the ability to recover. You don't have the ability for your brain to learn the actions that you put in practice that day, and things can become second nature that you worked on in practice. The other thing, in general, is that you must condition your body before you jump back into any sort of activity you do. It's very rampant in throwing athletes, particularly pitchers, where they will throw for a long time, many months. They'll take a few weeks off or a few months off, and then they'll start throwing right again, and at the speed and intensity that they had just left off at. And they'll have pain in their elbow or in their shoulder. A lot of times you have to gradually get back into things before you should attempt to do the intensity or the amount of repetitions that you're used to doing. The other thing that I often see is just patients are fatigued. They're not getting enough sleep, and sleep is incredibly important. Good sleep hygiene habits: not looking at your phone right before you go to sleep, not looking at your laptop, not watching television, sitting in bed with it on your lap, as many of us do. And having kind of a routine and a wind down to get good restorative sleep, so that the strengthening and the technique work that you've done during that day of practice can imprint in your mind, and you can have an injury-free season.